be wanna photo. Say we did fight.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shark is inside now. I'm at say so on link copy. But
Tompo 11 p.m.
Oh, if it comes a seed in the who give me, I guess some entanglement before that side.
You know they hear social distancing, eh?
To leap from D, some crowd, the whole. As I be young in the Emmas are they cool. If you no go pick me to catch him and small left.
See, this be the problem. Who tell you say corona affects youngins? If you know they care about your life, if a guy say NSL be over 50 years, away get hypertension, way poppy to be diabetic. Charlie them their go mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will they take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die. Will you be able to fend for yourself?
Chama, so I can say more. Because unless I start, they do Yahoo, enter Benino, na funeral cost me this the COVID said make it left one at top. Who?
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID don't go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to lazy my shadow make beans in.
If you love yourself and the people around you, they house and take your shadow go do go back cry.
You are here, you more like dog me. So they kill my cry.
But we for take responsibility and keep fighting with positivity. Never
All right, welcome back, viewers. We have another wonderful discussion for you today. We have our regular guest, Kwame Sapongasiudu, who is a pharmacist with over 22 years of practice, ranging over a wide different number of pharmacy practice areas. He's lectured before, he's into public health. We also have Nana Kofi Kwache, a public health specialist and a doctoral candidate at New York University, who has been very active in this COVID period, bringing us a lot of good information. We'll assess the latest COVID-19 developments in Ghana and related public health responses. So at this point, let me bring in my guests one after the other. Hi, Kwame.
Hello, how are you?
I'm doing well. How are you doing?
Well, I can't complain. I mean, we are not in normal times, like I always tell people.
Yeah.
So
anyway, hopefully you're able to weather the storm, and then things get better.
I wish I could be positive. I wish. The reality of the matter is, under the circumstances, when you look at the dashboards, I can't. But I hope we see ourselves through.
Yeah. Let me bring in Nana Kofi. Hi, Nana Kofi.
Hi, Professor. Good to see you. Thank you for having me.
Yeah, good to see you. We have a lot to discuss today and wouldn't want to waste any time. We'll delve right into the issues. So there's been a lot of things that have gone on this particular week in relation to COVID, and we're going to take them one by one and hopefully go through a number of them so our viewers can have a sense of what is going on. And I would also want to provide some educational tips on how people can protect themselves, especially since we have the new strains in dominance. And we'll get to this at some point. So I want to begin by asking Kwame Sapongasiudu. So Kwame, new restrictions were imposed beginning of this week, right? Can you share your thoughts on them? And do you think they are doing anything to address our current predicament? And are the restrictions we have in place, being targeted correctly to ensure that we get out of this situation properly?
Thank you. The thing about COVID is the fact that whatever you put in place in a week would only manifest itself in 3 weeks. Sad as it is, that's the reality. Because the infections we're seeing today are a result of the activities we engaged in, give or take 10 to 14 days ago. So what the president said 6 days ago, the reality of its impact would not be known as I speak to you now. And I'll be naive to give you an indication that I have a perspective on how that is playing out. So I would want to go back to 3 weeks ago, which was what the president's previous broadcast to the nation, which is actually no different from what he told us a week ago. Because in reality, all he said a week ago was that we need to comply with all the protocols, we need to social distance, there was going to be enforcement, give or take. So I would want to say, if he said the same thing 2 weeks after, then I can make an assessment based on what he said 3 weeks ago. And the honest truth is, the average numbers have slightly gone up. I mean, we're looking at about 742 cases a day in the last week, from 693 when he spoke 3 weeks ago. I can understand that when he spoke last week, he talked of an average of 700. So if I was even pushed to base my analysis on what he said last week, which from a public health standpoint would be an inappropriate analysis, I'll say still our trends are not good.
Right.
The other thing you have to look at is our mortalities. When the president spoke 6 days ago, he said we had had 64 deaths in 2 weeks. If you check the Ghana Health Service updates in the last 7 days since he spoke, we've had an average of 8 mortalities a day. If you are someone whose mathematics is challenged, you realize that 8 times 6 is 48, which means we've had 48 deaths in 6 days. If you add tomorrow, let's assume we go by the average, it will be 54 deaths in a week. That tells you in 2 weeks we had 64, in 1 week we've had 54, and our trajectory is on an ascendancy. Because if you just use the law of doubling, 54 times 2 would be 108 in 2 weeks, when we had 64 in 2 weeks, 2 weeks prior. So when I look at all this data, and I look at the Ghana Health Service data, and I look at their website, and I see the number of critically ill, severely ill, and I see that if you are someone who is pedantic, as Nana Kofi is, I know, and I am, you'd realize that in reality, our severely ill and critically ill numbers change in relation to our deaths, which means a lot of people who go on that log actually die. And that's scary.
Right.
Because they go on there and they don't come back to inform our survival statistics. Rather, they knock off and end up in our mortality statistics. And if you've done that trend analysis for 10 days, which I've not spoken to Nana Kofi in the last few days, but I'm quite sure he is someone who is very pedantic with trend analysis, and he would give us the data to show that that is a trend. But I see it by the trend analysis, I look at that. Our critical and severely ill are going up, but our mortalities are going up as well. And if you look at the knock-off, our mortalities are because people are getting critically ill, and not because they are getting critically ill and getting well. And that gives an indication of the probability that our health system is getting overwhelmed. And therefore, critically ill people are not getting the level of management they need to traverse whatever challenge they have.
Okay,
for me, this is where I would want to stop, and this is where I think we need to be paying critical attention, because people are not coming back. They are getting to the brink and tipping over, and that should be concerning.
Right. Thank you, Kwame. Nana Kofi, can you give us a few thoughts on this?
So I think Kwame has covered most of the difficult realities of where we are right now. It's abundantly clear that, especially with this week, with the confirmation from Professor Wandari at WACBIP, that the UK strain is now dominant and driving spread of COVID-19 in Ghana. In Takoradi, we saw 9 out of 10 of the sequence samples came back for B117. And Greater Accra was about the same. And if you think about, especially the Takoradi situation, it wasn't too surprising for me, because I recall, I think 2 or 3 weeks ago, the supervisor of testing at the lab there actually talked about the fact that they were seeing such a high positivity rate. That the number that they actually quoted at the time was 30%. So it makes sense that they would be having their spread there driven by something that's more infectious. And if you look at what they're seeing at Ifeanyi Kwantena Hospital 3 weeks ago, something that's also more severe, where their ICUs were full, they were having to try and identify more space. It's not even a real ICU, just treatment centers are full. They're trying to find more space to treat people there. So we know that this is actually what's going on. And sadly, it would appear as though the limitations in energy, manpower, time, and actual infrastructure in our critical care, in our severe care, means that there are some people who need certain levels of acute care who are not getting it. Not because the doctors aren't trying, because they are operating beyond the limits of their ability right now, but because the numbers are just so high for people who are coming in on admission. It's a really unfortunate, consequence of where we are. But like Kwame said again, we should expect this to continue for 2 to 3 weeks for the hospitalizations and infections, and maybe 4 weeks more for the actual mortality to start going down, because the impact of the policy decision isn't immediate in the data. It takes a while for it to record it, and not even as a question of the data, but as a question of the reality on the ground. I think we're at the point where we have to be very focused on breaking transmission. You cannot have a variant like B117, the UK one, in circulation, where you know it's more infectious, where you know the clinical epidemiology is different. You cannot keep doing things as normal. We really have to get it in our minds that the short-term goal must be to suppress transmission. That will mean some trade-offs to economic activity. That will mean some trade-offs to social and religious and cultural activity. But this is now about actually saving lives at a time where all the backstops for saving lives in the healthcare system through critical and severe care, that's at its limit. So we can't rely on that right now. So it's about really stopping the transmission, because it's impossible to see how we can have what we've already seen: schools open, the infections beginning to happen there, knowing that communities aren't complying, and knowing that the guard is still down. It's very difficult to see how we take steps forward if we do not have official policy rolling things back.
Let me step in for a second and ask you one question. I mean, we know that the new variants are highly infectious. They are transmitted, way higher than the old variants, right? So what are the things we should be doing to combat this?
Well, I think for one, it's a no-brainer. I mean, all the things that we are doing in terms of economic activity that's still going on, conferences, the leeway for small weddings and funerals, that kind of stuff. We really have to cut down to the bare minimum. We have to really be at, in terms of, again, like how this country felt as it did at the end of the lockdown or right at the end of the lockdown. We simply don't have, we have to make sure that we are putting in place all those policies. We have to be more clear about what the thresholds for closures are for schools. You have a school where they've done 500, in a question where they've done 500 tests and found 42 students positive. That's an 8% positivity rate. What are the thresholds at which you say, okay, for a boarding school, that means we are not going to do classes, we're going to have students quarantine their dorms. What's the threshold that says, okay, for day schools, we are going to close them down to prevent kids coming and getting infected and taken to their communities? What are those thresholds? We need to know those things now, because we are operating in such a limited threshold that we have to be able to be doing that kind of dynamic thinking. Thresholds that say, okay, we are at the point where we're going to need a curfew to make sure that people are not going out at night at all, and enforce it. We need to know a threshold where we can say, indoor dining, we know it's a high risk setting. So why are we still having restaurants open for indoor dining? We really have to be looking at all those little things where we can tighten. We have to tighten, because we at least have to get the infection rate down to a level that we know our contact tracing can keep up. If you look at just the last 10 days of January, we recorded almost 13,000 cases. And if all those cases have 10 contacts to trace, I mean, the numbers that we're talking about here with what has been, people have been recruited to pick up contact rate, it's just not feasible. We can't get this under control that way. So we have to focus on transmission, make sure that we are trying to reduce all the opportunities that we can upfront, so that we don't have to rely on a contact tracing effort that will be inadequate, not because people aren't trying hard enough, but because the numbers of the contact traces versus infections is just not a fair game. And also so that we're not leaving the hospitals to pick up the slack from the infections and the consequences.
Okay, let me bring Kwame in. Kwame, it looks like we definitely have to look at the right solutions to getting out of this predicament we are. Nana Kofi has said a lot. I wanted to know if you had a few things to add.
No, Kofi, like I said, Kofi, I expected him to come down because he's more pedantic into the epidemiological numbers than I am. I like to look at the trends and what the trends tell me. And I always dwell on the trends. So anytime we've had private conversations, that is the disparity of, and don't get me wrong, the intricacies of the data, like Nana would do, and all the heat maps and all that is what informs the trends. The problem is that we haven't, through this pandemic, looked at both. So you had a situation whereby we had people in public health monitoring a pandemic who were saying, oh, reproductive numbers were irrelevant. People were saying doubling rates were irrelevant. The gestation time was irrelevant. And I remember having a conversation with Nana Kofi back in May, and I was like, nah, so then what are we monitoring? And so it then brings us to the heart of what he's been saying all along, that we technically monitored little by way of trends. Now we're in a situation whereby this whole thing seems to be metamorphosizing into a monster. And I've said it on the networks, and I'll say it here today. The point is, COVID might not be killing thousands like we see across the globe. But when it comes to Ghana, it is killing quality. And that's scary. I've lost my colleague, soulmate from primary school, through secondary school, through pharmacy school, through appointment as a lecturer, who became a professor at below 50 years. And all of us academics know at that stage, if you become a professor, you've got at least 2 decades minimum to give to society. If you become an emeritus, God knows you've got as much to give until you're called. Roly poly is gone. At give or take 48, 49 years, same as my age. I'm speculating because I don't want to make my age public, but we are age mates. And you start thinking, for how long can we go down this trajectory and traverse this path without realizing the harm it's doing to our country? So we need, beyond the statistics that Nana would talk, beyond the epidemiological dimensions that Nana would talk, then it was seen as him trying to be an academic or me trying to be an academic. Now it's seen as the reality of a virus coming in and picking one person after the other in a manner that is entirely preventable.
Kwame, whilst you're on this issue, there's something, and it has to again do with the public health messaging. We hear this mantra that is currently being spread, and it comes from the government officials and public health specialists. And then it is like, oh, the evidence doesn't say that, oh, there's no data to support that COVID is spread in the market. There's no evidence to suggest that COVID is spread in churches or and in my opinion, it tends to downplay the risk of COVID-19. I want you to talk about this.
No, I was going to go there. Well, that was the trajectory I was going on. And it's great you brought me there earlier than probably I would have gone. The point is, when we engage in pseudoscience, I borrowed that from Nana Kofi again. He is an accolade of using that term, pseudoscience. And more importantly, we allow people who do not understand the science of epidemiology to engage and propagate pseudoscience because we have decided to skew our sampling that would inform actual science, because there's a disparity between pseudo and actual science. Actual science is when your null hypothesis, and I can understand that people are watching us who are not researchers and would struggle with what is Kwame trying to say. Null hypothesis is you start from an outset to say, I don't know what is going on. I want to find out what the truth is. That is null hypothesis. So your null hypothesis is on the basis of, I don't know, and I want to know. But you then peddle pseudoscience to communicators on behalf of the state, who then say the analysis doesn't point to trotus spreading, political activity spreading. But then the same people turn around and hail the Ghana Football Association for sanctioning Accra House of Folk because people went to see Samamo at a match between Hearts and Olympics that Hearts lost, and they are saying they didn't wear face masks and they are spreading COVID. Ask myself, are we deluded? Are we really deluded to the point? And that is where Nana Kofi's pseudoscience analogy comes in. Because in one breath, you're saying the same thing that the people were doing and enjoying themselves at a political activity didn't spread COVID. But when they did it at a sporting activity, it spread COVID. Are you normal? Are you thinking correctly? You see, and this is what we need to start speaking up to and getting people to realize that we are brave as a people to confront such misconception in a manner that would allow the society to stay safe. Because as it stands now, the society is not safe with this warped information.
Okay, Nana Kofi, in just a few sentences, maybe under a minute, if you wanted to add something to what Kwame has just said.
No, I mean, I've been working on an article over the last few days, and yesterday I remember watching the statement by the WHO director, regional director for West Africa, and she was talking about how they decided to distribute the Pfizer vaccine. I tweeted about that earlier today, and it was already in the COVAX document, but she highlighted again that they based it on a country preparedness, and then B on assessed need, like what was the perception, what different countries needed, and it made me think a lot about the question that Kwame is going at on how we communicate these things and how we present the data and how we sample, and whether we have an accurate sense. Because we're in a situation now where the rubber has hit the road. We're in a very difficult situation when transmissions are concerned, very difficult situation where hospitalizations are concerned, and a vaccine would be really helpful here. Now, I don't know if we applied for the Pfizer vaccine, but we are scheduled to get some of the Oxford AstraZeneca. That one hasn't received an emergency use license from the WHO yet, so shipping will start late February, maybe early March. But the Pfizer vaccines, those are available now. About 300,000 doses got distributed around the continent, and one of the things they looked at was what's the rate of new cases you have. Now, that's obviously a function of your testing. If you're testing 1,000 people a day and you're coming up with a very low number and you're saying that's representative, that's what they're going to base, the degree of your pandemic severity on. If your mortality data is delayed 3 weeks, 4 weeks, 5 weeks, and they're looking at your case fatality rates over the period where Africa has been growing up and Ghana are the lowest of the case fatalities in that window, they're not asking whether or not there are more deaths to be confirmed. They're not asking whether or not there's a review process that's delaying that. They're looking at your case fatality rate and saying your situation is not that bad. And you can see how that is going to affect not just the Pfizer vaccine, but the rest of vaccine distribution, where if you come and say or present the data as though you don't have a very big outbreak or that the consequences of that outbreak are not that high, when it comes to things like distribution of aid or assessment of need, you're obviously going to have that need assessment done based on your data, which is skewed rather than on the reality. And it's something that I hope that we are, it's one of the more practical examples of why, like Kwame says, sometimes we talk about it like it's just a data entry error or it's like a question of data consistency, but it's because the data is actually used by other people who actually care about data for their policy decision making. And as Dr. Samagudu said on Twitter today, we actually can't do this by vibes. You actually have to have data that backs up, that's representative reality to back up your request for vaccines and all those other things. And it's important that at this stage, going forward, knowing that now it's critical that we are clear and honest about the data, that we are timely, because it influences how quickly this pandemic ends for us now. So I just hope that going forward, there's more consistent focus by public health communicators from the government and by also the media still. It's important that when we are reporting what's going on about this current situation where we are right now, that is reported in an informed context. You don't just say, I'm hoping that when we are covering and looking at coverage of the data going forward, that there's more critical analysis to say it might not be complete because of this. When especially you know why it might not be complete or when you know where the gaps might be, it's important to include that so people have an accurate sense, because it requires that collective understanding of what we actually need so that we can collectively demand for accountability. Otherwise, we're going to be in this situation that we find ourselves where, the stories we're telling ourselves are coming back to haunt us.
Nana Kofi, whilst you're still on, I want to ask a question. This was actually in relation to a tweet that Dr. Samagudu put up. And let me just paraphrase. What she was saying was that it's quite humbling that in all this while, we will not even be able to store or prepare for distribution of the vaccines from Pfizer, even if we got them. And it's quite a disturbing issue. Are we making plans or are we getting ourselves ready to have some of these vaccines, even when whenever we get the chance to, in terms of storage, transportation, and the rest?
Well, that's the official line, that there's effort, there's work going into preparing the ground for vaccine. I've spoken to a few people who do work adjunctly with that team, and it does sound like there's some preparatory work being done. But as usual, it does sound like it's kind of reactionary. We waited for the vaccine to be available before we started planning for it. You compare that to some other, I know it of like, the comparison to Rwanda feels like it's overplayed, but I remember seeing on TV 3 weeks ago, Rwanda showing off their full Pfizer storage facility, something that could actually store up to minus 80 degrees Celsius when what was required was minus 70 degrees Celsius. They showed how many vials they could store in each of the coolers. They showed the whole facility. They showed what kind of vials they were going to take. And they could show that because they had done the work, I went back and looked at to make sure that it wasn't just PR. There was a full plan. Locations are publicly available. There's a plan as to where you can get a vaccine. It is a full, proper public distribution plan that if you were a local health director, you can look at it and say, okay, for my district, I know that this is what I can expect at this time, and these are people I have to target. I'm not sure we are there yet, and I think we do need to speed that up, because we should try and put ourselves in a position where we are not constricted by when we get the vaccine through the licensing process, because we know that the WHO, like even with the COVAX distribution list, they said specifically for AstraZeneca that there was no guarantee that the timelines are going to be what it actually was, because the review process might delay. Pfizer is what's available now. If we're ready for that, we might be able to get a couple 100,000 doses to start with our healthcare workforce. So again, it comes back to a question of, I hope that what we are hearing is true, that there is some concerted effort going on to get a comprehensive facility set up and a comprehensive distribution plan established. But I think there's reason to be a bit skeptical about the timing. I just hope that we can speed it up and get it out as soon as possible. At this point, it's hard to describe how very urgent that is. Anything that can reduce the burden of mortality, reduce the burden of morbidity, and cut down transmissions, absolutely very welcome. So I hope that they're working on that and that there's progress there. But there's not a lot of information in the public domain as to where progress is.
Okay, now let's move on to another discussion, and let me bring in Kwame for this one. But Kwame, before we go on, if you have maybe under a minute to talk about what Nana Kofi just talked about in terms of our readiness to receive vaccines.
Simple put, anyone who wants Africa to get vaccines that have to be stored under freeze-dry condition or liquefied nitrogen and doesn't have a protocol similar to what Rwanda has rolled out, which I've read and which Nana Kofi has alluded to, is delusional. And that's all I'll say.
Okay. Yeah, that's a fair point. Now on to another issue that is very worrying. I find this quite disturbing, and this has to do with our legislators, our members of parliament. We have heard, or it's been put in the news, that 15 of them, or let me say at least 15 of them, have tested positive. The previous, or a few days ago, we're hearing that a lot of them, which is in the numbers of about 50, were refusing to get tested. We talked about this briefly last week. I just want us to hit on this issue again. What message is this telling our people? And are they not breaking any laws? Is there no way we can hold them accountable?
This whole week, especially after George fell, I spent much of my day listening to Land of Our Beds. It's a hymn that transcends ages. And in the second verse, there's something that is said that is poignant. It said that they may grow from age to age and dignified and unbridled heritage. The point is, we are seeing people who do not realize that their behaviors have consequential impact on the next generation. And therefore, they think it's all about them. We saw them in Parliament when, in the midst of a pandemic, they decided to go into a brawl. And so, first thing, 275 people, 15 currently infected. And I can say on this program without fear of contradiction that 15 are the current infected. The reality is a lot more have been infected because I know. And if I'm called anywhere, I'll defend the statement to the peril of my life. 15 are currently infected based on the recent test. The reality is a lot more. At least anyone listening to me knows Carlos Ahinkra was infected earlier. So that makes it 16, doesn't it? So if I say 15 are infected currently, that is the line I am taking. The point I'm making is that 15 divided by 275 gives you an infectivity positivity percentage. That is on the basis that some have decided not to test, which then means that we are dealing with a house that doesn't realize the reality of the times we are in. Because even with all these numbers, they are not prepared to isolate. Because they fox, you see, the reality we have to deal with is if you and I were unwell and work in our normal workplaces and were COVID positive, we would isolate, wouldn't we? Ghanaian politicians and parliamentarians are well catered for, that they are no different from you and I who work out of Ghana.
Mm-hmm.
In fact, they are better off than us.
Definitely.
So there is no reason why they can't isolate, is there? No. The reason why they are not isolating is because of the bad behaviors they go into. We have a parliament that's hanged 137 hang 1, which then means if you have 3 people infected on one side and there's a crucial vote, they lose. So people are being actually coerced to come in and engage in parliamentary activity. Because if that's not the case, what the speaker was saying should be amusing to all of us. If you go and look at Odikro, our parliamentarians are not known to be people who regularly attend parliament. In fact, the attendance rates are low. How come suddenly in this parliament, even when they are unwell and can endanger people and break the Public Health Act, which clearly states that if you have a disease, that actually makes you a risk to the society, and you decide to put society in harm's way by your behaviors, you are breaking the law, you are committing a crime, they are willing to commit a crime. Why? Because the parliamentary mathematics and architecture makes it such that they don't want to find themselves. So we have a parliament now that puts their party ahead of nation. And
Yes.
that is the fact of what they are doing and why the speaker has to make a call on this, because they are being criminal by our laws, the Public Health Act. They are going out when they can infect others. They are drivers, they are, thanks to all the risks, now they all have police guards. Mm-hmm. So they can infect them, they can infect their drivers, those can go to their homes, they can infect people. So we are causing propagation of a pandemic when new strains put us more at risk. How silly can we be?
Kwame, those are really heavy words, and I hope that some way, somehow, they get the message and begin to do the right thing. It doesn't make sense to put your party or your political affiliations over the interest of the nation when it comes to public health. So now I want us to bring this closer by talking about ways we can empower people to protect themselves from this COVID-19, especially since it is confirmed that the more infectious and more lethal strains are what are dominant. And Nana Kofi mentioned this. The study showed that 88% of new infections in Accra, 90 in Takoradi, even Tamale was up 25%. So let's look at how we can protect ourselves. Kwame, I'll bring you back on.
I would have wanted Nana likes these statistics and he's more endowed, but I'll take a shot and I'll defer to him. Yes, I mean the data speaks for itself. And for me, last week after the president's speech, I watched the Director General of the Ghana Health Service and Professor Awandari from WAGBIB on Joy, and I was really disappointed because the Director General of Ghana Health Service decided to go down that trajectory of, and this doesn't spread COVID, and Professor Awandari, being the academic that he is, objected and said, I want to disagree and put the statistics of seroprevalence studies out. Why am I referring to this? I'm referring to this because we cannot continue making these analogies in the face of all these evidence that we have a new variant and what it can do to us. The point is that at the end of the day, we are the ones who are going to get infected. We are the ones who are going to fall ill, and we are the ones who are going to die. And I would conclude before I see to Nana Kofi by saying we are in self-preservation mode at the moment. There's enough evidence that the communication coming from officialdom to us is not aimed at keeping us safe. It's aimed at a particular narrative. So we need to be smart, read between the lines, and work at ways to keep us safe. And that's how I'll leave it for now.
Okay, Nana Kofi unfortunately had to leave. He has to attend to something. So, Kwame, I want you to take the next few comments, and then we'll begin.
Yeah, that's fine.
Yeah. So schools have reopened, and we've heard infectivity or infection rates in students are going high, even with the minimal testing they are doing. Now, parents are worried. I had a discussion with somebody who told me today that some criminals have started taking advantage of the situation. They started calling parents, telling them that, it's been announced that their kids are sick, asking for money to be transferred to them. So, people are taking advantage of some of these situations to try and rip people off. So, I mean, they are worried and they are getting what advice can you give to parents who are really concerned about this? I mean, in terms of, we have to look for a way to empower people to take care of their own health if, those who are in charge of us are not doing much to protect us. So let's just end by talking about ways we can keep ourselves.
You see, I wouldn't speak to the parents. It would be naive for me, speaking on a public health platform, to speak to the parents. That would be totally incorrect. The point is that public health drives on robust communication. And therefore, I would expect that the communication to the parents would be spot on. Because if the schools, if the education system is communicating to the parents, they would be able to identify what is spooked communication and what is official communication. The reason why people, anytime you see, what do criminals do? They identify cracks in the system and they exploit it. So these people are basically telling us there's a cracks in the system and we're going to make money out of it and we're going to exploit parents. So if I sit here and say the communication to go to the parents, I'll be doing a disservice to the parents. The communication should go to officials though. Please communicate properly so these parents can get the right information and can know when to discredit information that's coming from non-official. Until we do that, parents would be anxious. They would want information, and whatever information comes to them, whether right or wrong, they will take. So the idea is to populate the space with as much credible information as possible. It's the same as vaccines and anti-vaxxers and all that. The reason why anti-vaxxers thrive is because the vaxxers sit back and assume the rest of the world would know what vaccines have done throughout history and why you and I are alive, because we all had the childhood killer disease vaccinations, and the fact that those vaccines are no different from the vaccine, apart from the mRNA vaccines that, and that's just two of them to be fair, are part of this vaccine cohort. If the vaccines like you and me are not prepared to combat them as pharmacists, as doctors, as the custodians of medical knowledge and fight back, how do you blame a parent who's read this on the internet, seen this on cyberspace or YouTube, who believes it? Officialdom should change the game of communication. You and I, as health professionals, should change our game of communication. And that is why I spend time coming on programs like this. Yes. Because unless we change the game plan and fight in an unorthodox, we've been traditionally fighting in the orthodox fashion. Oh, I'm sitting in my clinic, I'm sitting in my pharmacy, I'll communicate this and everyone will get it. We need to change the fox pass and communicate in an unorthodox fashion and ensure that some of these things are confronted head on. Until we do that, these things will happen.
Yeah, thank you, Kwame. And I would like to say that is one of the reasons, and we really appreciate you for coming on every time, yourself and Nana Kofi, to educate our viewers. And this is why Health Info Africa organization was formed. It's made up of entirely scientists and healthcare professionals who felt that there was a vacuum that was filled by conspiracy theorists. And so continue to stay with us, share our feed, like a feed, let other people know of the authentic information when it comes to health, because as it stands now, there is so much false information. It's been a wonderful discussion again with Nana Kofi and Kwame. I'll bring in Kwame to give us his last words as we bring this first session to an end.
Thank you. Daniel, I would end by saying this. None of us is safe until the last person is informed. We need to continue to inform everybody. We need to confront the negative narrative, and we need to engage until such time that everyone has a basic understanding of the challenges that we face. When we get there, some of us will bow out. We probably wouldn't even speak in the public space ever again. Until then, all of us have a stake and must be here.
All right. Thank you very much, Kwame, for being with us once again. And we hope to have you with us again next week. And hopefully by next week, we'll have better news coming from Ghana. So at this point, I'd want to go on a short break. And when we come back, Edward and Angela will take the next part of the Health Info Africa show.
Be one a photo. Say we did fight.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shack is inside now. I'm at say so on link copy. But
Tompo 11 p.m.
Oh, if it comes a seed in the who give me. I guess some entanglement before that side.
You know they hear social distancing, eh?
To lepe from D, same crowd, the whole. As I be young in the Emas are they cool. If you no go pick me to catch him in small left.
See, this be the problem. Who tell you say corona dey affect youngins? If you know they care about your life, if a guy say NSL be over 50 years, away get hypertension, way poppy to be diabetic. Charlie them there, go mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will they take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die, will you be able to fend for yourself?
Chama, so I can say because unless I start they do Yahoo enter Benino, na funeral cost me this the COVID said make it left one at top.
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID don't go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to lazy my shadow make beans in.
If you love yourself and the people around you, they house and take your shadow go back cry.
You are here, you more like dog me.
But we for take responsibility and keep fighting with positivity.